If we think of our gut bacteria as a community which contains negative components, neutral components and positive ones, what we obviously would like to see is an increase in the positive components. Prebiotics were generated and set up to try and achieve this. Other factors, however, can affect the ratio of good versus bad. These include stress, whereby normal levels of gut bacteria can become depleted. As we get older, our levels of positive bacteria also decrease, and also some common medications can have an effect upon the ratio negatively. And together, these do perhaps increase our chances of a health concern. So prebiotics are very much set up to preventatively manage these. What prebiotics do is fortify the good guys which are present inside the good or positive bacteria, and these then have an effect upon immunity. Actually, something like 70% of our total immune response is in the gut, and the reason for that is that the gut is crammed full of bacteria. These are very stimulatory to the immune response. But what we like to do is to make sure that those stimulants are good bacteria rather than more negative ones, and prebiotics would achieve that. What prebiotics do is increase the mass or the bulk of bacteria which are inside the gut. Now, if they work properly, and they should do, that should be a mass of good bacteria. And what this has a further effect upon is transit time or the feeling of regularity. So any associated discomfort with regularity should be helped by a good prebiotic. In terms of overall nutrition, it is critical, very, very important to keep our balance or composition of bacteria inside the gut correct or as optimal as we can. This means higher levels of good bacteria called bifidobacteria, which are very important for human health. Now, these can also impact upon overall nutrition. For instance, we get improved calcium and magnesium absorption when these bacteria are at their highest. So prebiotics can help overall nutrition as well as specific effects upon immunity and the feeling of transit times.